Tips and techniques for providing oral care. Oral care is sometimes low on the list of priorities when it comes to resident care. Not because it is unimportant, but because it must compete with many other essential daily tasks. Care staff may find it unpleasant providing daily oral care because it invades the resident's personal space, and they are sometimes unsure of best practices. Care providers often face additional challenges when attempting to provide oral care to residents with dementia, due to possible memory loss, lack of communication skills, lack of motor skills, or behavioral concerns. Given that oral care plays an integral role in overall health, it is important to make oral care a priority every day. Remember, poor oral hygiene can lead to bad breath, cavities, swollen and tender gums, and loose teeth. Oral pain and discomfort can make it difficult for the resident to chew their food, which will affect their digestion and ultimately result in poor nutrition. In some cases, poor oral hygiene can be a factor in the development of heart disease, stroke, and pneumonia. In this section, we will outline how care providers can use verbal and nonverbal cues and other techniques to assist people with dementia with their daily oral care. Often people with dementia are perceived as being unable to perform their own oral care. However, with some guidance, changes to their physical or social environments, or modifications to their oral health tools, some people may be able to overcome the challenges associated with dementia and complete oral care activities by themselves. It is always best to allow a resident to complete his or her own care if possible, even if you don't feel they are doing a sufficient job. Adherence to daily oral care practices is more likely when the resident is involved with their own care. As a care provider, there are a number of things that you can do to assist your residents with their daily oral care needs. Residents with dementia often provide a special challenge. It is important to consider the timing of oral care, communication strategies, positioning, etc. Here are a few tips for providing daily oral care to residents with dementia. Timing of oral care. Set a routine time and place to provide oral care. The familiarity of a routine may decrease resistance over time. Provide oral care after a meal. At this time, residents are usually more relaxed, calm, and may be more willing to have oral care done. Do not wake a resident to provide oral care. This may increase confusion and lead to resistance or responsive behavior. Setting up. Gather all the necessary supplies ahead of time, and if possible, always do oral care in the bathroom. This environment will help to serve as a cue for oral care. Check the resident's physical environment. Is something preventing the resident from performing their own care? For example, the resident may have trouble reaching the sink or seeing themselves in the mirror. If there are concerns, try to think of possible solutions. Use a kidney basin if they can't reach the sink. Provide a hand mirror if they need to see while doing oral care procedures. Make sure the environment is calm and quiet with few distractions. For residents that are easily distracted, close the door during oral care. Ensure all oral care supplies are labeled, including the resident's toothbrush, dentures, and denture brush, in case they go missing. Allow residents to participate in their own care as much as possible. They may need assistance with setting up, cleaning up, turning the water on and off, or putting toothpaste on the brush. They may also need guidance with brushing and may need verbal cues to rinse and spit. Communicating with the resident. Always approach with a smile, which provides a positive cue to the resident as the activity is initiated. Identify yourself and say what you are going to do. The resident may have forgotten. Use short sentences and simple words. Speak slowly and clearly. Ask only one question at a time and provide only one instruction at a time. Communicate with the resident in other ways if their speech and ability to understand are limited. Use nonverbal cues such as smiling, gentle touch, or having the resident hold their toothbrush while you set up. Always use a positive approach. Start by showing the resident what to do, and then coach and encourage them to do the same. Break down the oral care process into small steps. For example, Step 1. Place the toothpaste on the brush. Step 2. Place the brush in their hands. Step 3. Place the brush in their mouth, etc. Give lots of praise and positive reinforcement, remembering again to use short sentences and simple words. You may have to distract the resident in order to provide oral care. For example, you may want to sing or count or provide the resident with a toothbrush or a face cloth to hold while brushing their teeth or dentures. Always encourage the resident to participate in their own oral care if possible. Positioning while providing oral care. If the resident is sitting in a wheelchair or in bed, make sure you position yourself so that you do not cause strain or stress to your back and neck. Ideally, if the resident is sitting, you should stand beside or slightly behind the resident. This will give you better access to the mouth. Stabilize your hand by resting it on the chin and pull the lips open with your thumb. If you feel any mechanical stress, change your position. You may also be able to lean the wheelchair back. If the resident is lying in bed, you can either sit or stand beside the resident's head. This allows for more visibility and less neck strain. While this position is ideal for preventing neck and back strain, it may not be appropriate when providing care for someone with dementia. People with dementia often lose peripheral vision. Therefore, positioning yourself beside or behind the resident may make them nervous, confused, or uncomfortable. In this case, it would be best to position yourself in front of the resident to provide oral care. If the resident is sitting, approach at eye level to appear less threatening and always approach with a smile. Providing daily care. If a resident is resisting oral care, never force them to have this care done, but set up the oral care supplies anyway. Use verbal and nonverbal cues to encourage the resident and talk about the importance of good oral health. If resistance persists, note what was done and if there is a particular time when the resident seems to be more receptive to care. Remember to try every day, even if not successful. Set a routine and continue to try. If you are having trouble getting the resident to open their mouth, try first to verbally coax them to open. If difficulties persist, try massaging the cheeks over the TMJ area to relax the muscle and encourage opening. The TMJ is the joint connecting the lower jaw to the skull on either side of the head. The joint is located just in front of the ears. If a resident is clenching or closing their mouth during oral care, you can try using a mouth prop to gently hold the resident's mouth open while you brush their teeth. Mouth props can also provide peace of mind to care providers who are fearful of having their fingers bitten when providing oral care. Mouth props can be labeled, cleaned, and reused. To use a mouth prop, wiggle the prop between the back teeth, then turn the prop so the wider portion allows the mouth to open more. If a mouth prop is unavailable, you can use several tongue depressors taped together or the handle of another toothbrush to prop the resident's mouth open. This is called the two-toothbrush technique. It is advisable to wipe the mouth with a non-glycerin oral swab or face cloth to remove excess food debris that accumulates in the resident's mouth before brushing with a soft toothbrush. Make sure to look inside the resident's mouth for anything different than the day before. Feel for any lumps or swellings and note any changes. If the resident is refusing oral care, it could be because they are in pain, so make sure you check their mouth for any potential sources of pain. If the resident has a tendency to swallow toothpaste, use only a pea-sized amount. Fluoridated toothpaste is beneficial for cavity prevention. If the resident has difficulty swallowing, use a non-foaming toothpaste or simply moisten the toothbrush with water or non-alcoholic mouth rinse. Removing dentures is sometimes difficult, but very important to do. Full dentures and partial dentures should be removed and cleaned every day. If possible, have the resident remove their own dentures. Otherwise, place your finger at the back of the resident's mouth, along the side of the back teeth. Loosen the upper denture by gently prying it downward, or the lower denture upward. The upper denture is usually the hardest to remove, but once the suction is released, it should come out easily. If a denture appears to be stuck and is very difficult to remove, seek the assistance of a dental professional. Always clean dentures over the sink. Line the sink with a wet face cloth or fill the sink 1/4 full of water. Hold the denture firmly between the thumb and forefinger of your non-dominant hand. Rinse the denture to remove any loose debris and saliva. Remove any denture adhesive materials that remain on the denture and thoroughly brush all surfaces of the denture. Use liquid soap or a foam denture cleaning product. Never brush with toothpaste. Toothpaste is abrasive and will scratch the denture surface. Once cleaned and rinsed, dentures should be soaked for a minimum of 30 minutes. Home support staff may consider starting their visit with oral care so that dentures will have adequate time to soak while they complete other care tasks. Soak dentures in denture cleaning solution. If commercial denture cleaning product is not available, dentures not containing any metal parts can be soaked in a mixture of 1 teaspoon bleach and 1 cup water. Doing a quick brush without soaking the dentures may not provide the disinfection they require. Rinse denture thoroughly before placing back in the resident's mouth. Remember, you'll want to put a clean denture back into a clean mouth. It is important to brush the resident's mouth with a soft toothbrush to remove debris and stimulate gum tissue. Always encourage the resident and use positive reinforcement. Do as much as you can each day. While you may not accomplish everything every day, you should always attempt to do oral care with each resident daily. Even if you are not successful, the cues are being established and the routines are being set. Make sure to record all difficulties and successes.